Bismillahirrahmanirrahim. Beginning in the name of Allah, the most merciful, the most beneficent. Nervous system. Nervous system comprises of major two subcomponents. Number one is a central nervous system. Another one is a peripheral nervous system. Central nervous system having a brain and spinal cord, while the peripheral nervous systems having somatic nervous system and autonomic nervous system. The somatic nervous system is further categorized into functions and their localities. The main autonomic nervous system is subtypes is a somatic nervous system, sympathetic nervous system, and parasympathetic nervous system. As we told in the sketch, the idea is a nervous system having a central nervous system, brain and spinal cord, peripheral nervous system having autonomic nervous system, and somatic nervous system. The autonomic nervous system having a diversified, classified into two major things, components, sympathetic and parasympathetic nervous systems. So here is the somatic nervous systems having the voluntary functions, which is under controllables, or it is controllable functions. A man can, and anybody can, animal, each and everything can control the somatic nervous systems by their voluntability. While the autonomic nervous systems, there will be no voluntability or the control under the humans. So here is the sympathetic nervous systems having further diversified, classified into two major subcomponents: ephedrines, adrenalines, ephedrine or adrenalines, norephedrines or noradrenalines. The US systems is telling the ephedrines, while another English countries having the adrenalines. So here is the major functions of sympathetic nervous systems and parasympathetic nervous systems. We will discuss about the functions. First functions, the organs which is originated and the functions from the thoracic and lumbar regions of humans, while the parasympathetic nervous systems originated from the spinal cord and cranial nerves, medulla. The major function of sympathetic nervous systems, generally we will think about that they are the controlling and alerting their body for the upcoming situations, the alert or the emergency situations. So they regulate their body for the upcoming challenges to a body or the abrupt challenges which is coming to the body. The first and fight and flight responses of body, which gives the another ones is sleep movements or relaxations movements. The parasympathetic nervous systems bring to persons to the sleep movements. Another one is dilatations of pupils, where for the examination of ophthalmologist, while there is the constrictions of pupils when the parasympathetic nervous system is activated. Another one is sympathetic nervous system increase the heartbeat, increase heart rate, beta 1 agonistic. While there is the beta 2 antagonistics, decrease the heart rate, cardiac rate, or the bradycardia it has. So there is the difference between the blood pressure and bradycardia. Bradycardia means actually the heart rate which decrease, not a blood pressure, just heart rate. While the BP in the atherosclerosis, or there is the hindrance which comes against the flow of blood is called blood pressures. Any hindrance which is coming. So actually the hindrance is coming due to the alpha-1 agonistic, due to activation of alpha-1 agonistics. So there is the blood pressures increase, activation of alpha cells, so opposing to the blood flow. So there is the hair, erections of hair which comes in the sympathetic nervous systems, while there is the slightly deprive like the hairs of the body relax urinary bladder before the urinations. The condition here is the constrict urinations, parasympathetic nervous systems. So here the sympathetic nervous systems contract anal sphincters, while the parasympathetic nervous systems constrict the anal sphincters. So here is the further categorization, as I told that the sympathetic nervous systems having the epinephrine or adrenaline, norepinephrine or noradrenalines. So the adrenalines, we have discussed that it is increase the blood pressures of patient. Another one is parasympathetic nervous systems having the muscarinic receptors and nicotinic receptors. So in both these acetylcholines is the major neurotransmitter and also the excitatory neurotransmitters also. So here is the norepinephrines. There is the hormones which is from the neurotransmitters having the main functions doing inside it, or they are presented at the top of kidney. Okay, another one we will go from the another side for the further diversified explanations. So here is the ANS, autonomic nervous system. So the sympathetic nervous systems and parasympathetic nervous systems we will discuss here, the diversified things inside it. So here is the same, that the sympathetic nervous system activate body for the challenges coming, environmental or external or internal challenges which comings inside a body, while the parasympathetic nervous systems having the body brings to the rest conditions. Here is further classified into further things, that the sympathetic nervous system has been told that the adrenaline or epinephrines. Function of the adrenaline's fight or flight responses, increase heart rate, increase body sugar level in intention to consume for any challenges or for any functions. So here is the also that alpha-1 is agonistic properties, increase the blood pressures effect, and the beta-2 is agonistic functions, or that beta-1 is present in heart while the beta-2 in lungs. So here is the alpha-1 agonistic property, and alpha-1 is also in blood vessels, while the beta-1 in heart, while the beta-2 in lungs. In alpha-1, which is present in the blood vessels, it increases the blood pressure by the agonistic properties, while the beta-1 is, when it is activated, so there is the cardiac palpitations is increased, while the beta-2 is agonistic property for the bronchodilations. So it is a function. And third one is a uterus relaxations. So here is the another one for the parasympathetic nervous systems. If we will focus upon it, there is the muscarinic receptor and nicotinic receptors. So the main is acetylcholine, as we studied before. So here is the decrease muscarinic receptors decrease bradycardia. It causes the decreased heart rates. Here is the bronchoconstrictilities. They are causing the bronchoconstrictilities. While we studied in the sympathetic nervous system, there is the adrenaline or epinephrines. We studied the beta agonistic properties. Here the beta antagonistic properties in muscarinic. So they are the opposite in each other. In adrenalines, we studied that it is functioning as the beta-1 agonistic properties, means they are the bronchodilation, but here is the bronchoconstrictions. For the societal purposes, due to these reasons, they are using the muscarinic agonistic properties, because it is the constriction of bronchospasm. It increases the GIT motility, emptying of the urinary bladders before urinations, dilatations of pupils, while the muscarinic receptor is further divided into three: M1, M2, M3. M1 is a function in the memory and learning purposes, as like for the hippocampus, hypothalamus, the memory storage, for the long memory storage, short memory storage, has the computer, like there is the RAM, random access memory, like the hard disk, like the long memory, it is same doing function like this. M2 is decrease heart rate, smooth muscles. Third one is a smooth muscle constrictions or relaxations. So this is the function. The nicotinics is, as its name indicates, nicotinamides, as we studied in the chemistries. So it is the binds to the prostaglandin inside a body and excitatory neurotransmitter. It is excitation's cause. So it releases adrenaline plus noradrenalines like this. So here is the further dividation is N1 hexamethonium, N2 is decamethonium. So N1 is also denoted by the NM, neuromuscular junction, while the M2 is autonomic CNS, adrenal medulla. So it is all the function about the CNS, and it is very interesting if somebody focus upon it. Thank you very much for my short lecture of nervous system.